It's a very important topic of pharmacology basics, bioavailability. Okay, so have you ever wondered why 500 mg tablet doesn't always have the same effect as a 500 mg injection? The answer is bioavailability, okay, which is fraction or percent of drug that reaches systemic circulation in its active form. But how? Now we are going to see drug journey. We took drug via mouth. For example, a tablet is swallowed. It must first dissolve in stomach and then absorbed by intestine into the blood and reaches liver. The liver metabolizes part of the drug and this is called first pass effect. We will see the first pass effect in another video. For now, we can say only a portion of the original dose reaches systemic circulation, which is also the active form of drug. If we summarize now, drug reaches blood, which is bioavailability. That is also the percent of drug or the fraction of drug reaches bloodstream after first pass effect. That is, the drug is metabolized by liver. In simple words, bioavailability is how much of drug reaches systemic circulation or bloodstream in its active form after being metabolized by liver. Okay, so for example, you took 100 mg of tablet. Okay, now the 70 mg drug, or can say 70% of the drug, reaches target site or bloodstream in its active form. Okay, now that is our dose. Okay, now that's the 70% bioavailability of that drug. Now, what happened to 30%? The 30 mg of the drug is being lost in liver, or you can say it is metabolized by liver and it is excreted out via urine or feces. We all can say IV has 100% bioavailability. But you know what? Why? Why IV and oral drug administration is different? Now let's see. The path of IV drug administration is simply IV, means into the vein, directly into the blood, and 100% bioavailability. Remember, bioavailability is about how much of the drug reaches bloodstream. So if we inject 100% drug in vein, we can say 100% bioavailability. That is why it is fastest onset of action and it is used in emergency. Now oral tablet. We have discussed this before. Tablet reaches stomach, then reaches liver, metabolized by liver, lost, and reaches blood. Some drug now reaches blood and some drug lost by the liver, metabolized by the liver. Okay, we can say it's lost. So the fraction of drug or percent of drug in oral is lost via liver. And also we can say IV is passing first pass effect. Passing first pass effect means that it is not reaching liver. Now the point of discussion is why drug is lost and how. As we all know, the drug is lost or metabolized by liver. So the first one is first pass effect. First pass effect is liver metabolize part of the drug and it is then excreted out by urine or feces. So drug reaches lesser amount in bloodstream compared to the amount we administered. Okay. The second thing is poor absorption. Yes, it can also affect the drug amount. Okay, due to drug food interaction in the stomach. First, and lipid solubility of the drug may be decreased. So, like we know, our body likes non-polar or lipid soluble drugs. And if the drug is water soluble more or it is hydrophilic in nature, then we'll have altered absorption. For bioavailability is very important for students. As we know, oral drug administration have low bioavailability. IV have 100% bioavailability. IM have 80 to 90% bioavailability, and all the other routes, topical, subcutaneous, intradermal, etc., have lesser bioavailability than 100. The topical route may not even be systemic at all because the local effect of the drug is like it's not absorbed and no concept of bioavailability or absorption is applied on topical formulations like lotions, creams, ointments, etc. This was about bioavailability and we will discuss its factors in the next video. Thank you so much.